Hello, everyone. Welcome to the Your Company Health podcast. Today, I'm super excited for my guest, Dr. Charles Krieger, from Krieger Health Solutions. He's an experienced chiropractor, and he's gonna, speak with us today and give us some great knowledge about what he does. So to get things going, first of all, Doctor. Welcome and how are you?
Well, thank you. Good to see you. I'm good.
Good to see you too. So to get things going for our audience, I want you to tell us your story and how you started in chiropractic care.
Okay. Well, I started in chiropractic care. Probably should say because of my uncle, my father's brother-in-law. My father came out of the Korean War in '53 and had a number of health problems that did not respond to regular medicine. And my uncle had recently graduated chiropractic school, began adjusting my father's health problems that had been unresolved for a few years, cleared up, and he decided to forego a career in electronics, which is what he was slated for, went to chiropractic school when there was no VA loans for chiropractic. So my mom had to work two jobs to put him through chiropractic school. And he graduated in '59. The reason I say my uncle, I mean, obviously I followed my father's footsteps, but it was my uncle who started the chain. And my father practiced in New York City starting in '59, unlicensed. There was no licensure for chiropractic in New York until 1965. So basically, my father was in constant danger of being arrested for practicing medicine without a license. Fortunately, that never happened, but it was a pretty dicey time in New York for chiropractors. The New York State Medical Society had an arrangement with certain policemen who would go by and do damage to your office. Awfully nice office you got here. Be ashamed if something happened to it, until licensure in '65. And then, from then on, chiropractors were licensed in New York. And I went to what's now Life University, and I graduated in '84, began practicing with my dad in '85. My son, Tristan, is at Life University, and he should be graduating 2024, I think. He's finishing up his first year in the chiropractic program, already has his bachelor's in biology. So there you go.
No, fantastic. And from talking to other healthcare practitioners, and it's always good when you start in the business with that rich history. When you were encouraged from day one. You mentioned your relative, your uncle. You were inspired by that. So I always see that in healthcare. In most healthcare practitioners, they're inspired, and that's what motivated them to start to do what they're doing. And so that's great. So I want you to, I know you mentioned how it started, but tell us now about what's unique about Krieger Health Solutions. What's unique about your technique and how you treat patients?
Well, from an early time in practice, I had the good fortunate life to be exposed to professors who were very interested in what has now been called functional medicine. So you probably heard that term. It's the use of nutrition and diet, lab results to help a person overcome chronic health problems. And my father was one of the doctors, one of the chiropractors who at that time in New York was using nutrition for his patients. And I became more and more interested, attended a lot of postgraduate seminars on nutrition and biochemistry and blood analysis and stuff like that. And then my son, when he was about, I guess, 7 or 8, 9 in that age range, he started to develop some pretty profound respiratory problems, which didn't make sense. He's getting adjusted. We're giving him children's supplements. He was, drug-free, never had a drug put in his body, never had his skin pierced. So why is he having these issues? And it took a while to narrow it down, but a colleague of mine said, he can't have gluten. So that was the beginning of a more in-depth journey into that, shall we say, functional nutrition aspect of chiropractic, where my son, and my in-laws are Romanian. If you know anything about Romanians, kind of like Italians in that they have bread with bread. I mean, there's bread everywhere. All right. The first meal I ever had with my future father-in-law at the time, we were eating Chinese food and he's looking for bread. Who eats Chinese food with bread? Romanians. Anyway, so my son grew up with lots and lots of wheat, and I never had an issue with it, so that I was aware of. But anyway, that got me on that journey. We became a gluten-free family way before anybody knew what gluten-free was. We're talking 12, 13 years ago. And then I started more and more into this. I had a patient who could not carry a child to term. She was on her 6th miscarriage, and she was getting into her 40s, and she was desperate to have a kid. And she was about to go the artificial insemination in vitro route, which, as you may know, that's like 30, 40 grand, and no guarantee you're going to have a kid. If you do have a kid, pretty high likelihood that that child is going to come out a little freaky deaky, because there's a reason the body isn't bringing the child to term. The body is incredibly smart. And if you as a woman cannot conceive or cannot bring a child to term, there's a reason for it. Your body isn't playing tricks on you. It takes a lot of energy and a lot of internal intelligence to create, form, and carry a child to term. So if a woman can't do that, something's stopping it from happening. And in her case, and then there's another person I did some work, lab work on, stool samples and blood work. Turned out she could have neither gluten nor dairy. Got her off both, arranged the correct supplementation. Now her child's in 3rd grade.
And doctor, that is good right there, because it's amazing to know that the importance of chiropractic care and how it can solve all types of ailments. Because there's this tendency that you only go to your GP for solutions to certain medical problems. When, as you mentioned, the root of most problems could be chiropractic care, because that's where your central nervous system is, right?
Yes.
And that's what you guys focus on.
Chiropractic, nutrition, exercise, good thoughts, those things are all important. You can't be healthy if you're not doing, and people say, oh, I don't go to a chiropractor and I'm healthy. Okay, maybe. There's a big difference between not having symptoms and being healthy, right? We've all heard the story. Did you hear about Bob? Bob was so healthy, and then he had a heart attack and died. Okay, Webster's dictionary time. Healthy people tend to not drop dead from heart attacks. But a little bit of an oxymoron there, okay? So symptoms are one of the things that we tend to base our health on, and it does make sense. Obviously, if you have symptoms on a chronic basis, well, something's not right. And if you don't have symptoms, that doesn't necessarily mean you don't have a problem, as people love to tell us now. Oh, just because you have no symptoms doesn't mean you don't have X, Y, Z. Won't get into the specifics of it because then we get political. But I try very hard to have my patients and others understand that chiropractic care and nutrition and other things like that are not treatments for anything. We don't treat, and that's it. And I think that's where some people can become confused about chiropractic. Like to this day, I have people say, "Can you treat my migraines?" No, but I can assess what's going on with you neurologically, structurally, chemically, and then we'll figure out what's wrong that's making your migraines. But I'm not going to treat your migraines. I don't do that. I don't treat, I don't cure. Okay, you're not bacon. I can't cure you. You're not a ham.
So you touched on a kind of conflicting thing right there with chiropractic care. So if that's the case, then why do I need to go every month or so for an adjustment?
define need. And that's the thing also, is that what do people want? Do you know that dentists spend a gazillion dollars on advertising, right? Whether it's Oral-B or Crest or Close-Up or Sensodyne or any of that stuff. I mean, we're hammered by the dental profession and its allies on a daily basis. To this day, less than 50% of people go to a dentist unless there's an emergency. Okay, so it's not a, you want to talk about need. Well, do you need to go to the dentist? No, not unless you want to keep your teeth, but you don't need to. You can get fake teeth, you know, and keep them in a jar. But with chiropractic, again, we're not talking about a need to see the chiropractor from the point of view of you're looking to treat a condition. Chiropractic is best used preventatively. We have the data that shows that chiropractic adjustments increase immune system function. The data exists. Now, because chiropractic gets, I think, no federal research money at all, any research that's done comes out of our pockets. We have not yet been able to say, oh, well, if you have the flu, you know, chiropractic care makes this difference. We haven't gotten to that stage of our research yet, but we have incontrovertible data showing that chiropractic adjustments beneficially affect immune function. We know that chiropractic adjustments increase frontal lobe activity by at least 10 to 20%. Okay, so these things we know. So it's not a matter of, do you have to see the chiropractor? You don't have to do anything. As Morgan Freeman said in a movie, I don't have to do anything except stay black and die. I mean, you don't have to do whatever you want to do. But more and more people are realizing that when their kids are under regular chiropractic care, they don't get sick like their classmates. My son, aside from his gluten problems, never had an ear infection. Never. Okay? Never had colds to speak of. So is that proof of anything? No, that's what we would call anecdotal evidence. But when it's your kid, that anecdote's pretty powerful.
Of course. And doctor, you're highlighting a very important thing right there. That's why I asked a question about the constant adjustments. So one key thing that you kind of put out there, chiropractic care, it's actually a preventative measure.
Yes.
If you're listening or watching this podcast, you should add chiropractic care in your rotation, do like an annual checkup with the chiropractor, just as how you would go to your general practitioner, because the tendency is there out there is there that we just go to our GP, do our annual checkup, and we neglect the chiropractor. But based on what you're saying and based on the statistics that you mentioned, I mean, it drastically improves your immune system. So it's a must.
It's not something that you want to say with a 100% certitude. It's been shown to do so incontrovertibly, but that doesn't mean that every person who gets chiropractic care is going to see an increase in their immune function. I want to be cautious about making absolute statements.
Okay.
But the same thing is true in medicine, right? If you have migraines and I give you drug A, just because clinical trials showed that it works doesn't mean that it's going to work on you, right? That's just how things are in healthcare. And the thing also about chiropractic care is that we're talking about health. And I can adjust you 3 days a week from now until the second coming. But if you're going to go home and live on Oreos and cupcakes and Diet Coke and McDonald's and Kentucky Fried Pigeons, well, it's not going to make that much of a difference, because the nervous system will only work as well as the clay that it has to work with. So that's why a big part of my practice is encouraging people to really, for some people, drastically altering their diets.
Nice. And fantastic. And what you're telling us, chiropractic care should be a part of your lifestyle.
Exactly.
And you have to aid it with, you have to strengthen your health with, ensure that you're eating right, just as how we know that we need to exercise. We need to do
Right.
all
Also,
these other
but
things.
we do need to have a discussion, which we're not going to do today, maybe another time, on what it means to eat right. Because the American public has been fed a steady stream of disinformation for the past half century. That's why there are still people to this day. I only have 2 eggs a week. Why? That'll raise my cholesterol. Bull crap. There's no data that shows that.
And I know that's debatable. We may need to do a show by itself about that. But I know that time, I'm telling you, doctor, we've been just talking and time is just running. But I want to get this in right here. I want you to just tell our audience, I'm a new patient. I just, came into your practice. Walk us through your process.
Okay. So my practice, like I said, I do what I call neural reorganization, right? People come in to see me. They usually have something significant going on. A recent new patient I had, 2 years of vertigo, okay? Just dizziness. And no help anywhere else. Now, in my office, you come in. Obviously, we have a sit down. We speak for as long as it's necessary for me to get the data out of you as to what's going on, what's your history. Then we do a digital evaluation to look at the different aspects of your nervous system. And I do a neurological evaluation, not from a neurologist's point of view, because the neurologist is looking to treat. I'm looking at how is your nervous system functioning right now? What is it telling me? And a lot of it seems stupidly simple. Like, can you stand with your feet together and your eyes closed? Can you touch your fingers to your nose with your eyes closed? It's like drunk tests, right? But a lot of those tests, when we look at them analytically from a functional point of view, give a lot of data, right? If I tell you to follow my finger back and forth and your eyes skip and bounce while we're doing that, that might be considered a negative test because you were able to follow. But I'm saying, no, that's not okay. Your eyes should be tracking smoothly back and forth. Then we go through those tests, and then we take some x-rays of you standing up, because weight-bearing x-rays tell us a lot about the structure of your body. When you're under the force of gravity, things will become evident that are not evident when someone's x-rays are taken laying flat on their back. So a new patient, I carve out about 90 minutes for them to be with me, because I want to make sure we find what's going on.
Yeah, fantastic. And that sounds like an extensive, assessment of the patient, so that you can strategize how you're gonna help that patient.
And then if we're then also going to go into a nutritional evaluation, that's going to be on a separate visit, because I don't want to torment somebody having them with me for 3 hours or something in one day. But then we'll go through a clinical nutrition evaluation and then send the person out for the appropriate lab work, whether it's blood, salivary panels, stool samples, urine, whatever it is that we need to get the information on that person to determine what's dysfunctional on that side of things. That also needs to be addressed.
And doctor, I want you to tell our audience about your Krieger Health Solutions overall, because I know that you have a nutritionist there. You have other healthcare practitioner there that, so you can treat the patient holistically. But I want you to talk about that.
Yeah, we have other docs or other healthcare professionals in my clinic. We have 2 massage therapists. We have 2 clinical hypnotherapists who also do family counseling. Actually have another chiropractor here as well, who he does his own specialty with low back pain. And I have a medical physician here. He's just begun, so we haven't really sat down and carved out how we're going to be working together. But that's going to be pretty awesome, because once he's here on a regular basis, I'll be able to use his expertise in drawing blood and helping me out from that standpoint.
Right. And I know, obviously, we're in the greatest pandemic of all time, and I know this has impacted practices in different ways. How has this impacted your practice?
Well, it impacted it where we were we were shut down for quite a while by mandate. And then there, of course, are a number of people who are understandably concerned about leaving their homes or whatever and coming back out again. So from that standpoint, yeah, it had an impact on the practice. We're coming back from that. I would point out that the number one comorbidity, or number 1 and 2 comorbidities, are obesity and diabetes with COVID. And with all of the attention and fervor that is being aimed at certain aspects of care, should be at least that much, if not more, on educating people about their diet and about exercise. Because you would see a rather significant reduction in the mortality rate if we had people. We're a rather obese nation. What is the stat? 60% of us are obese.
Mm-hmm.
All right. So we really need to be looking at that aspect of things rather than waiting for people to need ventilation. It might make more sense to have a national program that educates people and encourages them in the same fashion other things are encouraged,
right,
to eat more vegetables, put down the Twinkies, put down the beer, drink water, things like that. They would make simple things can make a very big difference in how someone's health responds to their environment. Simple stuff. Drinking enough water has a remarkable effect on the person who isn't drinking enough water. Right. I've had people, I'm dizzy, I'm tired, I'm this, I'm that. How much water do you drink? Water? I don't drink water. Pepsi, Diet Pepsi. It's like, well, that might not be a really great idea. Let's start you on some water every day and continue from there. So the pandemic, as such as it is, it has affected my practice. I'm looking forward to being able to educate people on how they can stay well. Not that, again, and I say this with as much, what's the word I'm looking for? As fervently as I can. I don't treat COVID. I don't treat it. It's not something I do. But then again, I don't treat anything.
Right.
All right. What I will say is that for myself and my family, I will feel much more secure in my ability to either not contract it or to deal with it as rapidly as possible if I'm adjusted and eating well.
So, Doctor, one quick point of clarification right there for our audience. So when you're saying you don't treat COVID, you're not saying you don't treat COVID patients or people who, okay, so just clarify that.
If someone comes into my office and says, Doc, I have COVID, can you treat me? I will treat you, but I'm not going to treat your COVID.
Right. Because, and I guess to expand on that, typically would be, you're more focused on the underlying situation of the ailment. You're more focused on the well-being of the individual, because with a strong immune system, you will counteract most of these diseases, right? That's what you're saying.
Yeah, I mean, that's what history shows us. That's what history shows, is that when the immune system is working the way it should. Again, is that absolute? No, nothing is absolute. The only thing that's absolute is that, at some point in time, I'm going to stop breathing and people will say nice things about me when I'm in a wooden box. That's absolute. Other than that, we can't be absolute about stuff, but the data clearly shows that when your immune system works as well as it can, you're going to have the best chance possible to fend off pathogens and opportunistic organisms.
You're perfectly right. And all the statistics show that there is a strong correlation with increased mortality and underlying illnesses, right? Yes. So so if you take care of your body and you have a strong immune system, you're more likely to fight off these diseases.
Yes, and again, you go back to what you said earlier about, well, why should someone go see, the chiropractor, however often they should. My personal recommendation for maintenance or wellness care is a minimum of twice a month. All right. But, well, why should you do that? Well, because it's going to maintain your health. But the same thing then bleeds over into diet. People have to make a choice. Is it more important for you to have biscuits and gravy or to be healthy? Is it more important for you to have a liter of Coke or to be healthy? Is it more important for you to have healthy kids or to give them Chips Ahoy and Captain Crunch and stuff like that? We all, well, he won't eat anything else. Well, one of you is the adult and one of you is the child. You need to figure that out. Okay. And that is a choice, unfortunately, that people usually often make the wrong choice, because the sensation here is more important than the health here. Right. I can't give that up. All right, well, then that's a different issue for a different time.
Yeah. So some great points, Doctor. I can definitely agree with you, and I know our audience can appreciate the importance of eating right and living a healthy lifestyle. I know we touched a little bit on the pandemic, and people, we're all, we have been remote. We're back in the offices now and all that. I know some practices offer telehealth services. Do you offer that for patients?
Now, obviously, I can't telehealth a chiropractic adjustment. I haven't learned how to do that yet. But
you can consult.
When it comes to the nutritional end of things, yes, of course. I can send someone off for blood work or whatever work it is. The blood work comes back to me, and we sit down and we have, like I'm talking to you right now, and we have a consult about what's necessary. These are the supplements you're going to use. I'm going to drop ship them to you, or whatever it is. And so, yes, and then we can do telehealth from that aspect, absolutely. Or I can consult with someone about a chiropractic issue until they decide whether or not they want to come in.
All right, that's fantastic. And Doctor, I know when it comes to chiropractic care, I know some chiropractors, they don't take some insurance. Do you take all type of insurance, or do you use insurance at all?
The nature of the work that I do is such that there's no billing codes for it. All right. So I don't take insurance assignment because the work that I do, it doesn't fit in there. It's the same as some friends of mine who are holistic medical doctors. They don't take insurance. The insurance doesn't pay for the work that's done. Now, that doesn't mean the patient can't be reimbursed for part of the work that I do. So when a patient comes to see me, I absolutely am more than happy to provide the patient with paperwork that they need to get reimbursed from their insurance carrier. If they want the codes and all that stuff, yeah, no problem. Here you go. You can go to the insurance carrier. Thing about health insurance is that health insurance is not health insurance. Health insurance is disease insurance. You don't go to the doctor when you're healthy and say, I'm going to use my health insurance. The health insurance doesn't pay for that. Health insurance specifically will not pay for maintenance care or wellness care. Medicare, the biggest insurance carrier in the country, specifically delineates that they will not pay for any care designed to maintain health or wellness. It's medically unnecessary. So if you're using health insurance to stay healthy, it's not going to work out really well for you, because the health insurance companies are not there to keep you healthy. They're there to keep you from being dead or to treat an illness. So using health insurance to stay healthy, there's a macabre joke about that. If you're going to use health insurance to stay healthy, then I hope you have good life insurance, right? Because the health insurance company doesn't care about your health. They don't. If they did, they wouldn't put these ridiculous limits on chiropractic care.
Yeah, you're right, and that's another conversation we can even add into another podcast. I can't believe we're almost at the end, but Doctor, I want you to tell us what is the biggest misconception about chiropractic care?
That we are here to treat back pain. Okay, The biggest misconception about chiropractic care is that it has to do with your back. If your nervous system existed in your nose, then people would call us nose doctors. All right. Your nervous system is in your skull and your spine, so we adjust the spine. But the major, shouldn't say misconception, but a conception that needs to be, that I try to, again, to fill into everybody that I come across who's interested in hearing about it, is that chiropractic care is for your brain. It's not for your back. Chiropractic adjustments stimulate brain function. And when you have chronic back pain, we have MRIs that show that that is correlated with atrophy of certain parts of the brain. So the longer someone is in chronic pain, neck pain, back pain, whatever, the more damage is being done to their brain. Now, I don't like it, to use chiropractic as a back pain treatment, because it's kind of like buying a $9,000 Wolf stove for your kitchen, and then all you do is make scrambled eggs. You'll make awesome scrambled eggs, but you're missing the point. All right. Chiropractic care is there to help the person be healthy overall, all body health. It's not going to treat a disease. It's not going to cure a condition. Do we have great success with back pain? Yeah, better than anybody else. But that's because back pain often is a result of neurological dysfunction. Chiropractic care corrects the source of that neurological dysfunction by adjusting the vertebra so that the brain and the body can communicate better. In addition, that adjustment allows the brain to communicate better with the environment. So you have an overall improvement of human function when people receive regular chiropractic care, whether that human is 6 months old or 60 years old or 76 years old. There's going to be better function. The brain has a better recognition of the body and its functions, digestion, respiration, reproduction, whatever you want, when the nervous system is clear, or as clear as possible, of interference because of what's going on in the skull, the neck, and the back.
Fantastic. Good information there, Doctor. Where do you see the chiropractic care in the next 10 years? How do you see it's evolving?
Ideally, it should evolve to be the primary source of health care for people, not disease care. We were talking about my father before. Recently, he had a bit of a health emergency where he had a heart attack, and that was combined with pneumonia. It was pretty rough. And we went to Northside Hospital. He was there for 6 or 7 days. They were frigging awesome. They were amazing, those docs. I mean, they did bum, 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 bum. They had him intubated, then they had a mask, then they had this, and they did that, and that was wonderful. I would never dream of ever trying to do something like that. It's not my job. So the medical community has an awesome ability to deal with crises, to deal with emergencies. That technology does not translate well to health. It's great for emergency than when the person's health is down, but it's not a great idea to keep giving somebody blood pressure medication when we can correct why they have a blood pressure problem. So I like to see chiropractic care as being that the primary stop where people make, and then the chiropractor says, no, I don't take care of that. You need to go see the orthopedist. You need to go see the internist. You need to go see the cardiologist.
All right. Well, doctor, has been fantastic. I can't believe, we could just go on and on and on. You have been great. Well,
thank you. You're not bad yourself.
and solid information. I know our audience will definitely, take away a lot from this. But we, as I mentioned, we're at the end. I want you to tell us before we run. Tell us how can we? What's your website and how can we learn more about Krieger Health Solutions?
Website is KriegerHealthSolutions.com. If somebody wants to communicate with me, they can communicate with me at Dr. Krieger at KriegerHealthSolutions.com.
Thank you, sir.
Again, we'll get back. Any emails I will answer myself.
Nice. And again, sir, thank you so much for stopping by on the show today. And
thanks for having me.
And And yeah, we'll definitely keep in touch.
All right.